Hey everyone, welcome to Easy Nursing, the YouTube channel that's dedicated to bringing you NCLEX reviews, general nursing tips, and practice question videos. Today we're going to be talking about selecting an IV site. Now I know for me, when I was in nursing school, one of my biggest worries was when you go to clinicals and you're expected to start that IV. I was worried crazy because for one, I didn't even know where I was going to put the IV. I couldn't tell left arm, right arm. Do you do it in a vein you can see? How do I even tell if it is a vein? I just didn't know where to start. So selecting an IV site, once you know where you got to put it, this is going to make the rest of it so much easier and you can actually do what you've practiced. So how do you pick an IV site? Well, first thing you want to do is determine in which extremity you want to put the IV in. So for starting, left arm versus right arm. When would you want to avoid a particular arm? Well, for one, look at the patient's preference. Typically, you want to avoid the patient's dominant arm because that's the arm that's going to be moving more often. You don't want to obstruct it, and also, since it's moving more, it's at increased risk for the IV getting inadvertently pulled or tugged or damaged. So if the patient is right-handed, typically try to avoid the right arm, and if at all possible, do the left arm. Now, that's not always the case though, because sometimes you just have to completely avoid an arm, such as if there's a hemodialysis site in an arm, because you don't want to accidentally damage the site by poking any of the veins around it. A patient, if they had a mastectomy, you don't want any damage to that arm because that arm has poor healing, and if you damage it, it could become infected easily. Now, if you see an arm and it's got wounds, burns, or cellulitis and infection and swollen, you might want to avoid that arm as well because you don't want to spread any infection or damage a wound that's trying to heal. Now also, if a patient has a cast on the arm, you don't want to start an IV in that casted arm's hand because if for some reason it were to become infiltrated or swollen or infected, it would then could cut off blood supply to the hand. Another reason is if a patient has a blood clot or a DVT in that arm, you don't want to accidentally push that blood clot loose and then it could go to the lung, the heart, or the brain. So that'd be a big problem. And also, if a patient has a PICC line, now it's not often you'll be starting an IV on a patient that has a PICC line because a PICC line can be used for intravenous access, but you want to avoid PICC-lined arms as well. Now, what about legs and torso and the neck? Well, typically, at least where I work, you'll need a physician's approval before you're able to utilize those sites. Plus, you also have to deal with all these issues here as well. So typically, always go for the arms first. Alright, now you decide which arm you want to go for. How do you select a vein? Well, there's two parts. The visual inspection, which is where you're looking at the arm, what veins can you see, and this can be with or without a tourniquet. And the same thing with palpation. What can you feel with or without a tourniquet? And sometimes what you see, you can feel, but sometimes you can't see it, but you can feel it. And vice versa. So they're both important for you to make a good decision about what vein you want to go for. Now, with both of these, you want to be sure to practice on yourself and your family and classmates because you want to get to where you're used to knowing that spongy feeling when you press on a vein. And when you look at your arm, a good one is right here above your thumb. There's usually a very good squishy vein there for you to look at. Now, as far as visualization, you can look at your ACs. Try to follow it from your hand to your AC and just see the blue lines running. Now, when it comes to inspecting someone's arm, it gets to become a little bit of a rhythm to it because everybody is anatomically similar. So as you can see from this diagram, there should be two main AC veins here. And then you see these nice, straight, lovely, long veins running up the front part of the forearm. Okay, so when I go to start an IV, typically, I'll be looking, if you see here, there's going to be some nice, long, straight veins running down the front part of the forearm. You can see you should have some nice AC veins here as well. And then you're just going to see lots of these little tiny veins around the wrist. This is typical in every spot. I told you about the squishy vein. You can see part of it right here along more the side or the top of the forearm. And this is going to be almost the same on every patient. So once you find a vein or a series of veins that really work well for you, you can go from every time. But let's go ahead and talk a little bit more about visualization. What are we looking at? Alright, so first off, let's look at some bad veins that you don't want to start. Look at this vein. If you were to start here, do you see all these squiggles here? It's hard to tell how large this is from the picture, but for comparison, if the IV you're starting, the catheter kit is about this long, there's no way you can get that good inch or inch and a half in one of these sites. So we want to avoid any of these squiggly veins. Also, if you see a spot where there's a bifurcation, you typically want to avoid it because you're going to be hitting valves and possibly puncturing the side of the vein. Let's take another look. Here are some veins that you can visually see. These are in the hand. For one, you see definitely some squiggling going on here. You can also see that this looks almost like an old person's hand. It's quite loose, and you can visualize this. So you could probably palpate these veins. They're right here on the surface, but I almost guarantee you that these veins are going to be very loose, and we'll talk about how to start IV on loose hands a little bit later, loose skin. But you probably want to avoid some of these, especially in the hand, because the IV is going to be sticking out about this far, and then you're going to have the tubing wrapping around. And so it's just going to be a real bother to the patient. Plus, this is the patient's right hand, and most people are right-handed. So you probably would want to avoid that spot for an IV. Also here, you can see this is the antecubital fossa. And these are the typical, you see ER patients always come in with IVs right here in the AC. Yeah, you can see them. You can probably feel them. I like to avoid these, though, for inpatient nursing, because the patient's going to be bending their elbow. So whether it's started above the AC or right below, you're going to have problems with bending, damage to the IV, and the IV being positional, meaning when they flex their elbow to scratch their nose, the IV pump's going to start beeping at you. It's a little bit different if you're doing like surgery or ER, in which case you just want to get an IV quick, and typically those patients you want to get a big fat 20 gauge or 18 gauge IV in here. So it depends on what kind of IV you're wanting to start. Me personally, being a med-surg nurse, I avoid anything in the AC or the hands. Alright, now with palpation, you can see this guy has some lovely veins here. You can see here him actually palpating his vein. You can see it visually stick up. Now, when I talk about visual inspection, I was talking about the color. You could see the color, not necessarily see the bump coming up out of the skin, but here you can definitely see the veins sticking up out of the skin. You can easily feel those. These would be lovely to start, especially because you see how straight they are. Now, I told you to avoid bifurcation. So if I were to start an IV here, I would probably start somewhere around here. So that way by the time the IV goes in, it only comes to about right here. You don't want to start right at the start of a bifurcation. If you're going to do it, start right after, because you don't want that vein, that IV that you're doing in the needle, to be pushed up and then be pushing on the valves. Because every time two veins come together, you're going to find a nice lovely valve there. So nice straight veins like this, you could probably start it just about anywhere. Let's look at some other veins to palpate. Look at these lovely veins. So you could probably palpate these, but they're not quite the same. You can see this is looks like some elderly skin, maybe some skin damage to it. You'll be able to feel it, but I'm telling you, these veins are going to be moving around a whole lot. You just want to be extra careful if you were to start an IV here to really hold it down. So sometimes, just because you can feel it, you could probably palpate these. If you can see, maybe not even palpate, but see some nice straight veins in the center of the front of the forearm, those veins typically hold a lot more steady while you're starting the IV than something like this loose skin around the hand and the forearm. And like this, you can see it and feel it, but you're going to have some problems with the patient's hand moving. So unless it's an emergent situation or you can't get an IV anywhere else, try to avoid these veins, even though you can palpate them. Some other issues that you'll see when trying to select an IV site, you can see tattoos on a patient. This doesn't affect palpation very much, but it could affect visualizing, especially if all the ink's covering the vein, you might not be able to see it. So you just got to get real close, and sometimes you can still find it. Edema in the arm, such as like a CHF patient, or just a patient that's obese, the increased layers of fat cover up the vein, so you can't see it as well and you can't feel it as well. If this is the case, AC, typically there's less fat located around the AC, so you can take a look around there. That might be the only spot you can find. The hands typically are very swollen, but go ahead and take a look for color as well, because typically you're not going to be able to feel on a larger patient like this, but you can still see the vein underneath the fat. And some people have issues with darker skin. It does cover up the color, but it depends on the darkness of the skin. So this may make it more difficult. In this case, you may want to depend more on palpation for a vein. So now let's look at 3 different arms I picked here, and how I would and where I would choose to start an IV. So this vein here, I'll be going just off a look. Even though you see it coming up a little bit, you probably can't palpate these very well, at least not as well as this. So what I would do is, this really would depend on visualizing the vein. So probably would have my tourniquet up here by the AC or just above. And I'm not going to be starting anything probably from here down, because I don't want here would be the IV and then all the tubing would come down. That's going to be in the way of the forearm. So the forearm and the AC are both going to be giving issues with positioning. So I probably wouldn't want to start any lower than this. So I can see a perfectly straight vein here. If I were to do this, I'd probably do it. You can see a bifurcation. Avoid this. I would probably start my IV right here in the vein. This one, I see it's straight all the way up. I would probably start as far down as I can see, anywhere from here to about an inch from the top, because I want it to be able to sit all the way in. So with this IV, I could start anywhere from here and probably about here. So anywhere in here is good. Anywhere in here is good. It looks like we have another vein here. It's a little bit harder to see, so I'd probably go for one of these 2 first. I do have a bit of straight from here to here. If I were to start right here, I'd have that full about inch to start an IV, so I could start right here. So those would be some. By then you should have an IV. Okay, you also have another patient's arm. So let's look at this one. This is one that you can palpate. Okay, we can't really see the color, but we can definitely see and feel. So I probably want to start. Don't start on the AC. Probably don't want to start any closer than about an inch and a half from the AC. So anywhere from here up, preferably lower. So I definitely would avoid this positioning problem. I'd probably start anywhere from here to here. On probably these 2 veins are the most easy to view. I do see another vein running here and here. So this really gives you 4 good shots. Now let's take a look at this other arm. I am going to avoid the hand by all means, and preferably I don't want to be any more than, this is like the only worst case scenario. Looking here, I can see a vein running up here. So I would want to avoid here, because if starting here you got some squiggles. So avoid anywhere you got those bifurcations, I tell you. Avoid the bifurcations here, avoid the bifurcations here. This is nice and plump, but like I said, by the time the tubing comes down, it may be in the way. So let me go ahead and clear this. I'll show you where I would start the IV on this patient. Probably start it here, and it would probably run up to about here. That would probably be the best shot for this patient. If this is a vein I'm looking at here, I'd probably start it maybe here. Looks pretty straight, starting just above the bifurcation going up. So like I said, don't start anywhere before the bifurcation. Start just after and work your way up. Don't start at the bifurcation. Start just after and work your way up. So this is how I would choose where I would start an IV. Now, another thing you want to think about, last thing about selecting vein, is what is the purpose of this IV? Like I said earlier, I try to avoid the AC in the wrist because I want to make sure for an inpatient patient that is moving a little bit more and it's not critical, that their IV is not going to be causing them problems. But if you're in an emergency, you want an IV anywhere you can get it, preferably a bigger vein such as the ACs, because you can give emergency medicine, blood transfusions. So definitely if you want blood transfusion, you'll be wanting to look for a bigger vein. If it's for surgery, the patient may be requiring blood transfusions. If it's definitely a intense surgery, so you'll want a larger IV and a larger vein. If it's a clinic and they're just there just to get a quick blood transfusion and go, the quickest the better, just for ease of use. However, if you're inpatient, you'll want a vein like I showed you, but avoiding part of the AC, parting part of the wrist, and try to get it within that main forearm, because that's going to be sturdy and steady and no positioning. So you got to just think about what's your patient getting the IV for. Well, that's all I have for this video. It's just about where to start the IV, what to look for. Remember, avoid the bifurcations, and inspect visually as well as palpation and see what works for you. And if y'all want to see another video maybe about how to start an IV in more detail, well, this is only one part of it, so if you want to see the rest, comment below and let me know what you think. Otherwise, please like the video and subscribe. This is Easy Nursing.